September is Ovarian Cancer Awareness Month, and today's Women's Care Wednesday. Dr. Megan Indermaur from Women's Care Florida is here to share the symptoms, risk factors, and thankfully treatment options for ovarian cancer. Welcome to the show. How are you?
I'm good. Thank you very much for having me.
Well, we're glad we're here because this is one of those topics that I don't think we can talk enough about and realistically. And I want to start off though by talking ovarian cancer. When you get that diagnosis, how do people typically get the diagnosis and what do people need to know?
So ovarian cancer actually has extremely vague symptoms. So it is technically very difficult to diagnose at first. A lot of patients will complain of abdominal bloating, which, you know, if you eat the wrong food can cause abdominal bloating, distension, changes in bowel function, pain that might be intermittent. So it's actually no specific symptom. It's a bunch of symptoms together. And so they'll complain to their doctors, but we might blame it on their GI, and then they have to come back and then finally come up with a diagnosis.
Well, that's kind of why I asked right out of the gate talking about getting that diagnosis, because I feel like there's been so much things, and maybe you've read at home, that ovarian cancer doesn't get diagnosed a lot because these symptoms kind of can get chalked up to other things like you were touching on, right?
Correct.
Are you seeing more women coming to you saying, hey, I want to be checked about this, I want to talk about this, more than what we had there in the past?
Well, I actually see them after they see their OBGYNs or primary doctors and they've had a workup. So, but I commonly get the story that I went to multiple doctors, I saw my primary, then I went to GI, and then I went to so-and-so, and finally they got a CT scan, and now I'm here seeing you. So it's very common. I wouldn't say it's more, but because that's always been the issue.
Okay. Well, I'm curious, when you do start talking with them, when you do see them, what do people, I mean, obviously it's a very scary thing to get that diagnosis. That first meeting with you, I'm assuming, is one of those that's a little intimidating.
Yes.
What are treatment options that are out there right now for women?
So it's really a multifocal treatment option, and there's two extremely important treatments, surgery and chemotherapy. So we rarely actually diagnose ovarian cancer early stage, but if we actually diagnose at the earliest stage, sometimes surgery alone can be it, but majority of patients actually require both chemo and surgery. Sometimes we do surgery up front, and these surgeries can be very large surgeries depending on the extent of the disease. Sometimes we're just taking out the GYN organs and then sampling other tissues to make sure it hasn't spread anywhere else. And then after that, typically give chemotherapy. Now, if a patient comes and they have advanced ovarian cancer that looks like it's all over the abdominal cavity, and I don't feel that I'm going to do my job from a surgical aspect, being able to remove all that cancer at once, then sometimes we give chemo first, then give do some surgery, and then give chemo again. And we have actually better outcomes from a surgical aspect.
You know, one of the things that you had already said that really sticks out to me is when you see patients, of course, they already have the workup. They've already been to their gynecologist. They've already got that diagnosis. I think that speaks a lot about Women's Care Florida, because all doctors are right under this one umbrella. So people are already familiar with you in a way, even if they haven't met you for that initial consultation, right?
Yes, yeah. So I'm very lucky because I have a great group of colleagues that are OBGYNs that help manage these patients and send them to me when they really think that there might be ovarian cancer.
What do you want people out there to end on, our last little topic? What do you want people to keep in mind out there? Because again, ovarian cancer is something very scary. I know there have been times where I'm like, oh, should I get checked for? I mean, I think we all feel that. What do you want people to keep in mind?
So there's a couple of things. First, you have to be your own advocate as a patient, and I don't think enough patients really push for it. And ovarian cancer, like we said, symptoms are very vague. So if you feel like you are not feeling correct and you're not doing well and nothing is working, continue to go see the doctor, continue to complain until we figure out what's going on. I think that's one very important thing. A second is make sure you get to the right doctor. We know that there is definitely great data supporting seeing a GYN oncologist for potential ovarian cancer. Those patients do significantly better with their treatment. And then really You know, it's a family involvement, so you really want everybody in your family involved to help care for you and to make sure everybody's getting the appropriate treatments.
I gotta say, you are just so lovely to talk to.
Oh,
I mean,
thank
this
you.
is not a good topic, but I really appreciate your time coming in today. And if you want to talk with any of the doctors or about any of the information that, of course, we just covered, there it is on your screen. Thank you again for coming in.
You're welcome.